This webinar was recorded on September 18th, 2024 for the subrecipients of the Tennessee Strong Families Grant. Kristina Casterline, SWRP's FFPSA Prevention Specialist, was our subject matter expert presenter. The main objectives for the webinar were identifying key strategies for initiating and maintaining community partnerships, exploring how to engage community partners across different service sectors, fostering trust with other organizations and clients, and sharing community resources available across the state of Tennessee. Today we're going to be learning about utilizing community resources for clients from Kristina Casterline. Kristina is currently a SWRP's FFPSA Prevention Consultant for Davidson County and the surrounding area. She holds a Master's in Science in Child Development and Family Studies, and she was previously a professor at Middle Tennessee State University and was on staff at the Tennessee Department of Health and UT Extension. Overall, she has 16 years of service to our state. So without further ado, I'll go ahead and turn it over to Kristina.
Thank you guys for joining us today, and we're so glad you're here to learn more about community resources and building those community partnerships. So I'm just going to start with just focusing on let's see, I'm not in presenter mode. There we go. So our goals and objectives for today, we're going to start off just talking about some foundational models. And so when I was putting this workshop together, I just realized that there are a lot of different models that really fit very well together when talking about building community partnerships. And you'll see how they kind of interact and overlay with one another. But I think it's really important that we use these models and framework to kind of set the foundation for what we're going to be learning about and talking about. If you have any questions as we go through, you can put them in the chat, and Brooke will stop and let me know what those questions are. So I do want to be able to respond to you as we go along. So don't feel like you can't ask questions. So this presentation is designed for you with you in mind. So I want it to be a benefit to you and meet all the needs that you have when it comes to this subject. So our second goal will be to understand the concepts and building those partnerships. So we're going to talk about ways that we can improve our communication skills and then how to kind of network and build those relationships. So we know relationships are key when we talk about community development, community partnerships, and then we'll also talk about some strategies that you can use to really start applying this information in your community. So I want you to already kind of be thinking about some agencies that you might want to partner with that you know are around. And then towards the end of the presentation, we'll actually talk about some resources. Some of these are statewide, some of these are specific to the areas that you have requested more information about. So hopefully that will be a benefit to you to learn more about those agencies and begin thinking about how you want to initiate a partnership or gain some contacts with those agencies. So we'll move along to the next thing. And so one of the foundational principles is being trauma informed. And so when we look at this, all these kind of set the stage for how we build those relationships, not just with our community partners, but also within our agencies and those individuals that we serve. So we know that's important to have and create a sense of safety. I know that you all have already had training on trauma-informed care, but I do have a resource if anybody is interested in actually going through the process of evaluating your agency to see if you have these components incorporated into your agency practice. So some of these can be policy things that you can put in place, and some of these can just be practices. But it's very important when we think about building community partnerships that we look at it from the lens of everything that we do, we want to be trauma informed. So creating that safe space that's within our agencies and then within our relationships. We want to build that so that we can, foster that trustworthiness and transparency. So we need to be honest about, what services that we provide, what we can and can't do, having that transparency so that families and the individuals that we serve or you guys serve have that knowledge of those resources and are not feeling confused or I'm sorry, I can't help you. You have to go to this other agency. So sometimes that happens, but just being transparent and clear with what your agency's purpose is, your vision and your mission. Peer support is the next one. So we want to be able to allow families to share their stories so that we learn more about what their needs are. And they're not going to do that if they don't feel safe in their environment, if they don't feel like they can trust you. So these are all critical components that really do work hand in hand. So we want to give clients an opportunity to do this, and then also in building those community relationships, we also need to allow agencies to share, like, what is working well with you for you and your agency? What successes have you had? So at the end, I'd like to hear from some of your agencies about what you're doing and how well things are working. If you have a great example to share, we want to be able to create an opportunity for you to talk about that. So I welcome you to do that towards the end. And then collaboration and mutuality. So we want to talk about how those power differences are leveled. So, creating everyone on that same playing field. So where nobody's leveraging any certain power or control within their agencies. So sometimes we do see that in agencies where, leadership feels like they have the control and they want to dictate, how things should be done. But we know that's not a trauma-informed way to approach those relationships. So we want to make sure that everybody is involved in that decision-making process. And this comes into play a lot when you have those collaborations or when you have those projects that you're working on where there's lots of different people at the table. So in collaborative environments, you do want to make sure that everybody has a voice, that everybody is heard, and that everybody has some decision-making responsibilities within their roles. So that kind of gets into some empowerment and a voice and choice. So just having that voice and being able to say, hey, I have a suggestion about how we can make this event better. So for example, I'm on the community advisory board in Davidson County. We're planning a fundraising event. So, everybody is coming together at that table to talk about this event and bringing their resources together. So that's a great example about how there's been trust that's been fostered within that group that's allowed for individuals to be able to share their knowledge and share their resources. And then with that, we also want to respect that diversity. So everybody comes from a different walk of life. We all have a lens within which we look at things and which we conceptualize things. Our own biases also can play a role in how we interact with others in our community and within our agencies. So just kind of being aware of that, having that self-awareness to know, like, hey, these are my biases, but I'm going to try to look past those and focus on, what's ahead and building this collaboration. So I feel like that trauma-informed practice is really key in helping us bridge the gap between those community partnerships. So that's one principle I wanted to address. And then, so try to keep this one in mind as we walk through the next two, and hopefully you'll see how they're interconnected. The next one, I hope everybody is familiar with this. So I'm a big nerd, so I really like Maslow and then Bronfenbrenner, which is coming next. So these two are just critical. And so sometimes I think that we forget about models and theories and things like that, but it really does help frame our point of view and our perspective on the work that we have with clients and with building those relationships. So we really need to think about, what are those foundational issues? What can prevent that top of the pyramid? What can prevent that from not happening? So, if there's things that are going on within your agency, so, there might be a crisis that's occurred and maybe the agency's gone through significant change or significant turnover, or has somehow got some tainted perspectives within the community. Those are barriers that would need to be overcome. So those things that we are looking at when we think about Maslow's hierarchy are the levels that we have to achieve that that the apex, which is the self-actualization. So we want to be able to reach all of those levels there. But we have to also consider that foundational piece. Are we at the foundation to where we can build upon those things? So with trauma-informed care, we have that safety piece, and we also see that here in Maslow's hierarchy with having that safety and security. So this applies in both areas. It can really make an impact on the strengthening of those relationships if we apply this framework. The next one I wanted to talk about is my favorite, is Bronfenbrenner's ecological model. And so with everything that we talk about today, I want to think about, you can put yourself in the middle. In our example, we have the child in the middle. So, for a lot of you all, it's going to be that expectant mother that you're serving in the middle of this. But put yourself in this, put your agency in in one of these other outer layers, but we really are looking at things from both a micro level and a macro level when we think about how all these are interconnected. And so when you take the principles of trauma-informed care, that safety, that collaboration, that trust building, that having a voice, that empowerment, and then Maslow's with having that foundation of having that safety and security, building that self-esteem. These are all interrelated. So hopefully you can see the connection between these models and really start thinking about, how am I doing this within the work, within my agency? How do you think people are perceiving you when they come into your center for services? Are they grounded in having that safe foundation? If not, we know we have to meet clients where they are. And sometimes when we're building community partnerships, we also have to meet that agency where they're at and what their goals are and see how we fit in with that puzzle. But just looking at it from this perspective, we can see how each of these circles impacts the other. So whether it's that mom you put in the middle or you put your agency in the middle, think about the things that are impacted from that micro level all the way out to the macro level. And we can see that interconnectedness there. So I'm not going to go through all of the things on here, but this is just a great visualization of how those connections work together. So we want to involve all these partners in our work and see, where we can make those connections. So the next slide is going to talk about eco maps. And so I think I can see most of you on here. And if you are familiar with how to use some of the features in Zoom, if you wouldn't mind raising your hand if you have ever used eco maps with any of your clients. Okay, so you can just raise your hand like this, or you can use the raise your hand feature. So I saw one hand, and then some people don't have their cameras on, so it's hard to say. Okay, so I see at least 3 hands. All right, so that's good. So some people are familiar with this. I think this is a great tool to use if you're not that familiar with eco maps. This is something that you can do with these clients that you serve and really look at, what are those resources? I'm sure all of you have met the mom that has come in and just feels just so overwhelmed with life, and they just feel kind of lost and they don't know who they can count on. And so what we know about protective factors too, is those social supports and those social connections are so important. And a lot of times when we're under stress or we're dealing with trauma, we're not going to have the ability to really think about, who is my support? A lot of times we'll just be like, you'll see those clients that are just like, I don't have anybody. Nobody cares about me. And I can't ask anybody for help because nobody wants to help me. We all know we've been there. We've heard that. But this is a very useful tool if you're really trying to get at, what are those supports for this family? But what you don't realize is that when you do this activity with your clients, you're also learning about resources in your community, and you're learning about, okay, what, I mean, don't you all agree that you learn more from your clients than anything? I know in the 24 years that I've been in service working with children and families, the families are the ones that have taught me the most. And there's nothing that beats that experience of working with those families and just knowing all the things that, that have worked with them. So if I have a client that I know has been to a certain mental health facility and say, they got treated poorly or they didn't get the help they needed. So we kind of know, okay, let's put one little tally mark by that agency and then know like, okay, is this going to be somebody that we want to really refer to if we know that that family is not being treated well? Of course, we don't want to just, one strike and you're out, but you can kind of build a kind of a checklist of how many times families have gone to a certain agency, or say there's an agency that's going well and they have a good response rate for that client. So you also want to kind of think about the ones that are working well for those families. So this is a way to not only help your clients determine what resources they have and who do they consider their support, but also can help you learn, what resources are they tapping into that maybe I didn't know about. So I've learned a lot from my families about resources, and I think using this model is just a great way to kind of help them visualize it too. So when you have that mom that comes in and says, nobody cares about me, nobody supports me, if you sit down with them, then you can start showing them. And when they see it drawn out like this, they're like, wow, I really do have some resources. So that really helps change their thought process and their perspective on their own situation, which we know the power of positivity. We know the power of hope, the science of hope. There's research that shows that, that those positive reinforcements, those positive and protective factors really make a difference in families' lives. So that's kind of the goal with this is also using it as a tool in building those community relationships as well as with our clients. Any questions so far? Okay, this is white, so I can't really see. Okay, there it is. So I've talked a lot about the risk factors and protective factors. So we can see these with individuals and also maybe within our own agency and then in other people's agencies or agencies that we might want to partner with. Think about how they're being addressed within their organization and within the community. So, there's lots of resources that are available to us, and we want to make sure that they're really meeting the needs of our client in order to consider them somebody that we would want to partner with. So thinking about these and just thinking about our clients, what are the things that kind of are barriers or stand in the way? Those are what we consider to be those risk factors. They can also be, as history. So if they're struggling with substance abuse or mental health issues, or if they've experienced any kind of trauma, we know that they're going to be better off if they have some protective factors in place to kind of balance those out. So the more that we can build those by using those eco maps, by using that trauma informed care approach, by considering, where are they on Maslow's hierarchy? But using this in a broad sense and applying it to the ecological model also gives us a full big picture. And I'm a big picture person, so I like to think about things, on a macro level too. But really, these are all very helpful just to kind of keep ourselves grounded in what is really going on with families. So we want to have a realistic idea or opinion on what is going on and really seeing it from that client's perspective, what challenges they're facing. And then also, what are the positives? What are the strengths that they have? So seeing those strengths-based perspectives. So like I said, we apply this on the individual level with the clients that we serve, and then we also apply it on a community level. So what things are going on in our community? What things are going on within the resources that we are, trying to get, maybe we're trying to get a formula for a family. Maybe we're trying to get diapers. Maybe we're trying to, hook a family up with transportation. What are those barriers and what are those protective factors that exist? So looking at those, we want to really be able to provide those services, provide that support, build those relationships, help that family feel connected to those resources, and then helping those agencies also desire to partner with each other. Another tool you can do is using a community needs assessment. So I don't know if anybody has ever gone through this process as an agency to kind of look at, what are your needs? How do you know how to address the needs that you have within your program? Also, I'm happy to share a checklist about how to make sure that your agency is trauma informed. But first of all, you need to really do some self-evaluation and then see how your role fits into that agency. Looking closely at your policies and procedures, looking at how you're viewed in the community. So identifying what is available in the community and then what those strengths are, what those protective factors are, and what those resources are. And then learning about the issues that are important to the community members that you're going to be working with. So you all have a very specific population, the pregnant mothers, new mothers, things like that. So when you have a very specific population, it helps you to narrow down what services that those families need. So I could ask any one of you right now, what are your clients' needs? And for the most part, you all are going to have very similar answers because you serve a very specific population. But we do know clients' needs differ. So one family might need housing, whereas another one just needs transportation. But we need to be familiar with everything that's available that can help these families that we serve. And we also need to know what's available so we know what we can tap into. So if we don't know, then how are we going to get connected, right? So doing a thorough needs assessment allows us to see the things that we're missing. It allows us to identify any gaps. So just say, I know some of your agency's names. Let me just do a random pick. So say Catholic Charities has access to interpreters, which I know they work with a lot of immigrant populations. So Catholic Charities could be your door if you have, maybe not a whole lot of different cultures or different languages that come through your door based on your geography in the state. Of course, we know Nashville has a huge population of immigrants and different nationalities and languages spoken. But if you're an agency that's like, whoa, well, we have this client that came in and they speak this language and we don't really have any resources for that, but Catholic Charities does, then you can tap into that as a resource and get connected. So that's why it's important to know, who is out there and who does what. And even in our next slide, we're going to talk about doing that within this group and really finding out a way to get you guys more connected. So you guys are on here doing training and learning, but to kind of create more of a community of practice with you guys of how you can learn from each other because you're serving the same population. You guys are a resource to each other and you probably don't even know it. So how can you guys as a group come together and build your own community networks and your own community resources and really help each other? So that's what it's all about. So another part of building a community needs assessment is checking to see if there's partnerships that already exist. So some of you may have relationships with each other. I don't know because I don't know you like that, but you guys know. You guys know who you have connections with. And then how are you addressing those things? How are you collaborating? How are you communicating? So all those things are important to kind of evaluate. And then recognizing those past problems and identifying strategies to overcome any challenges or barriers that you face. So we know when we have partnerships, they're not always going to, work out smoothly. So how do you overcome those barriers and those challenges? And then realizing that, you have to have the community's perspective before you can address whatever the community's concerns are. So that's really important. So what I was talking about is doing like a crosswalk or a matrix. There's different words for it. But basically something like this. I left it blank because this is something that you all can kind of brainstorm together on and work through. And I just kind of threw some of the names out there just so that you kind of have a visual of this. But you really want to look at this and see, okay, for these agencies, what services are being provided? Is there one thing that one agency is doing that the other one's not, that they can partner with or refer to, or help each other out? Or maybe somebody's applying for this grant and you want to kind of collaborate on that and be a co-grantee. So just kind of knowing, I think Brooke actually has something like this kind of already set up, that you all can kind of glean from and fill in the blanks and identify what those gaps are. But this is another strategy that you all can do, just within your own Strong Families grant group. Another thing is looking at different types of contributors. So if you think about people that you do have those relationships with, you want to really assess from time to time how those partnerships are going. So you want to think about people that maybe don't have that much of an impact and maybe they're not as organized, and how you can use strategies to kind of get them on board. So we have the spectrum there between not organized, not impacted, to highly organized and highly impacted. So there's a range with that. And so the main thing is just identifying, what their level is of involvement. Now, how involved do they want to be? Do they want to be 100% involved? Do they want to be 50% involved? Because you're going to structure how you communicate with them based on their needs and their interest level. So it might be somebody that's not that organized and doesn't have that much impact, but you want to just do minimal communication with, because they might not be able to really process that or be in a position to really help out with that. So you don't want to overwhelm them with too much information that they don't have the capacity to really handle. So you really want to just tailor your strategies based on where they're at in this spectrum. Does that make sense?
Kristina, I just want to ask a quick question that I'm thinking about. I know a lot of the services that are maternal health related sometimes have really long wait lists, or, they can be really bogged down as far as having enough resources to serve the amount of people that need it. What would you suggest for trying to partner with one of these agencies who maybe it might take a long time to get their client in the door, and they need something like immediately? Any ideas?
Yeah, I mean, so would that be like a TennCare eligible individual?
Sure, maybe I'm thinking specifically of housing. I know a lot of our organizations have said, I have this mom and the wait list for housing in a certain area may be like 2 years or something. Any ideas on collaborating with these organizations that are super overloaded? Maybe their impact could be great, but it's really hard to get in contact with them or get your client in the door.
Right. Unfortunately, we don't have any control over their wait list within their agency, but a lot of times they will be the ones that know about the resources. So even if you have a client that is on the waiting list, I would still encourage them to reach out to, their case manager or whoever's handling their case to see if they could refer them to other resources in the meantime. Sometimes some smaller counties might have more availability than larger counties too. So you might want to try to utilize things outside of that geographic area just to see what's available. But a lot of times they have resources too. You just kind of have to ask them and see, what else they could suggest for you.
Yeah, that's a great point. Thanks, Kristina.
All right, so I'm just gonna keep moving along with talking about some relationship building. So I mentioned earlier how important it is to have a shared vision, mission, and values and goals so that you know that you're on the same page with the people that you're trying to build these partnerships with. So it is difficult when you don't share that common language. So language is also really important to know what language to speak. And I don't mean like English or things like that. I mean the language of the agency. So sometimes you just have to kind of be around those different groups to learn the lingo. So I'm part of DCS. DCS has their own lingo that I'm learning that I have never been kind of experienced with versus Department of Health. When I was there, they have their own language that they speak. And so within every agency, you have kind of like your own lingo or language that you need to learn and get familiar with. And so you also need to know the language that these other agencies are speaking so that they will accept you and they'll say like, oh yeah, Kristina knows all about us because when she speaks, she'll mention this, this, and this. And so that can help build that trust, that transparency, and build that foundation for building that relationship. And that's what you want. So you've got to learn the language of the people that you want to collaborate with so that, you know, you can build on those relationships. So we need a lot of people working together with this. I think you all are a great group to kind of spearhead some of these relationship building and community development opportunities. And knowing that each community has different strengths. I saw in the chat somebody said, I love to explore clients' strengths. And that is so critical. And we need to do that within these relationships that we're cultivating as well, too. So, you know, let's see. I don't have that slide up with the agencies, but say we've got Porterleaf. So I'm familiar with Porterleaf in Memphis. And so you've got Porterleaf and say you've got Nurses for Newborn. So how can they kind of collaborate? What's their language that they have to learn? What can you all compliment each other on? Because you know everybody likes compliments. So especially if you're a director or you know you're seeing clients firsthand, you want to be able to say, hey, people are recognizing us for the work that we do. They're complimenting us. So the same way that we build on client strengths, we also need to build on the strengths of each other and the partnerships that we have and the agencies that we're utilizing as a resource. So, you know, the more that we can do that and build those relationships, you know, that's good. So learning about different cultures too and how to include them in decision making. And then appreciating that cultural diversity so that we can promote that equitable society. And a little bit about culture and language, just because, you know, we are a very diverse state from the west to the east. We have a lot of diversity. And so when we think about how culture affects the social organization and the leadership structure within groups, we need to really have some grounding in cultural competence and cultural diversity and cultural components so that when we approach people from different cultures and different organizations that we're respectful of that. And so things that we can do when we're meeting with ethnic and cultural leaders are, you know, just talk about their culture and heritage, just find out what's important to them. Because we all have our own biases. We all have our own ideas of what we think is important to somebody else. But giving them an opportunity to really say, like, this is what's really important to me. So let them tell you from their perspective what they feel is important. And then, you know, because that's what they value. And so when they value that, then you can in turn value that. So you want to gather information on those different cultural groups so that you have an understanding, like what is our population comprised of in Nashville? How many different racial groups or cultural groups do we have? So having an understanding of that and learning about how they interact with each other. And then building on those cultural traditions in a group. So if you're going to do some community events to try to bring in more different cultures and ethnic groups. Like, how can you appeal to that group? But you can't appeal to them if you don't know them. So you got to know. Then when we think about inviting others to the table, so say we want to create an event or do something, in the community to raise awareness, to promote our agency, even though we all have certain roles to do, I know everybody feels like they are on the marketing team or they are on public relations. I mean, that's just a part of what we do when we're in nonprofits, which actually your new term, did you all know that you are now called social enterprises? So the new term for nonprofits is social enterprises. And so you all are a social enterprise. And I just think that is such a cool term. I'm talking about language. How are you going to promote that? That you're a social enterprise now in the community. So thinking about that, thinking about when you're inviting others to the table, obviously you want to create a warm and friendly environment that's going to build that foundation of trust and safety, to give people the empowerment to use their voice. All the things we talked about as far as being trauma informed, we want to do that. We want to establish that clear communication and think about planning events that are going to bring people together and give everybody a sense of control or contribution to that event. So definitely involving them in the planning and implementation. And some communication strategies when you talk about bringing people to the table and trying to have some collaborations, you want to really gather some information on the agency that you're wanting to build that collaboration with so that you have some knowledge of that. Also learning some of that language that they use, speaking their language. If you have questions, writing a list of questions, what can I ask them that I really want to know? So you can, gain more knowledge. And then find out if you might know somebody within that organization or know somebody that knows somebody. So a lot of it's the connections that we make. And that can really kind of help us get in the door with these agencies and build that relationship. So if somebody referred you, you can, name drop. That really helps because, they know that person. They might have a good relationship with that person. And because they have a good relationship with that person than you do, they're automatically going to be more accepting of you. So that really helps if you can already have some kind of connection to that organization. So when you do have a meeting with them, you want to introduce yourself and your organization, explain why you want to have the meeting, explain the project, explain what you want to do, and see where they are at. When you think about that, the diagram that we had when we talked about their interest level and their organization and their impact, where are they? So you can go ahead and judge them based on that pyramid, or not the pyramid, but the diagram of how invested they're going to be in this project. If they're like, no, I don't really have time for that, but, put me down for this. So maybe they're on the low level. So you know what to expect. Okay, this person is going to contribute maybe 20%. But maybe there's somebody else in the agency that could contribute 60%. So you never know. And don't just take one person within the agency because there's multiple people that work there. And you just have to find the right people within the agency that's going to help build that partnership. So it might not be your initial person. So you might have to have more than one meeting to build that. But just know that there are different resources that different people can bring. So thinking about how they can contribute and then creating a plan for how that's going to be implemented. So when we engage and educate and collaborate, there's different ways that we can do that. We can do that peer to peer. So even within your organization, outside your organization, micro level, macro level. So think about all those things, how we can engage with our peers. What information can we learn from surveys? Say we want to do a needs assessment and we're going to use a survey to do that. Think about how you're going to create that survey. Maybe you want to invite moms and have a focus group and say, what did you enjoy about your services when you came here? What did you like when you first entered the door? Think about all those things. Think about how your agency is welcoming. Think about your agency, how they create a safe space. If you're really trying to dig into any of those principles of trauma-informed care, think about how you want to craft those focus groups to get that information. Because you want to be able to have outcomes and good outcomes for the work that you're doing. So the way to do that is to really think about how you want to ask those right questions. So you can do school-based flyers, school-based outreach with flyers, and then faith-based outreach is another one, neighborhood-based outreach. You can host public meetings or events. You can sponsor activities or trainings. You can have volunteers come in, have job opportunities. You can have a leadership circle or create an advisory committee or council. Everybody should have, a public facing website and hard copy materials. And then you can also do media campaigns. So I'm pretty sure most of you are really already using a lot of these, but there might be something that you haven't tapped into or an idea here that you want to try to implement. So I would just want to encourage you to try something new if you haven't and see how it works. So there are a lot of benefits to partnerships. So we see that there's greater success by involving people that are affected by the problem. And so with you all having a very specialized group and population that you serve, you know that you can make a great impact if you all come together. So we want to really create that collaborative environment where you're networking and building those relationships with new partners. And then once again, the strengths-based perspective. So understanding those strengths and what resources you bring to the table and considering any assets and also limitations. So building partnerships also provides an opportunity to build that credibility when you're working with others. And then that, trickles down to others in the community. So you have a macro level impact. And then you're able to share resources, creativity. Like I like the resource that Blair put together for us to share at the end is a great resource. So she's very good at technology things, and she developed a wonderful brochure for you all to use at the end that has all these resources that we have. And then reducing the amount of competing and fragmented services. So like I said, if you all wanted to partner on a grant together, which would increase your finances and other resources. So there's opportunities for you all to do that and build from one another and build on those strengths and resources that you have within your agencies. So does anybody have any questions about that before we move through the resources? Okay. All right, I'm going to stop sharing this for a minute because I have already pulled up all the ones that I wanted to share. So our first one that you should see is, of course, I'm going to talk about family health and wellness. That's where I used to work, family health and wellness for Department of Health. And so you have this on the slide. So I'm just going to go through some resources real quick because I still want to have time for questions and your success stories. We have 15 minutes left. So I want to make sure that we can get through all these resources. So here on the website, you can see they've got stuff for breastfeeding. CHANT is a great resource. It stands for Community Health Access and Navigation in Tennessee. That's also going to be on your flyer that Brooke made for you. So that is like a resource hub. So if you have a client and you know they need lots of stuff, you can just send them to CHANT and they will hook them up because they are a resource hub for lots of things. We have evidence-based home visiting program that is geared specifically for pregnant moms, new moms. So definitely take advantage of that. There's your family planning, fetal and infant mortality reduction, maternal health innovation, maternal mortality review, NAS, newborn screening, lots of resources for pregnant moms. So if you have some time and want to go through this, would definitely suggest you doing that. Welcome Baby is one thing that's in the presentation. And so that is like a free app that new parents can download and talks about all kinds of stuff. It talks about the development of your baby. It talks about health and safety. It talks about finding a pediatrician, talks about daycares. So it is a huge resource. I actually have this on a PDF if you would like a copy of one. because right now it's on an app. And so back in the day, they would send out these booklets. Well, they were wasting a lot of money with, return addresses and things like that. So they created an app. But they still have the print version available. If you'd like to see that, I could provide you a copy of that. But anyway, great resource here for family health and wellness with Department of Health. Another resources for childcare is TQEE. And they have a clearinghouse. So they have education, health and development, family and community. And so they look at all these things right here on the right. So all kinds of resources if you want to help families get connected. Definitely take a look at this. I wish I could move this bar out of the way. There we go. Next we have jobs. So I know you all said jobs, helping people get connected with jobs was something that you wanted help with. So this is the Virtual American Job Center. So you can create an account. You can go to their job fairs that they have. You can get clients connected with lots of events that are happening and help them get a job. So that is a great resource. Adult education through the Department of Labor and Workforce Development. So if you have, a mom that wants to go back and get her education or wants to further her education, or say you have people that need help learning English. So there's all kinds of resources here for people that want to further their education. Then with housing, we have the Tennessee Department of Tennessee Housing Development Agency. Sorry, I said that backwards. But there are a lot of programs for first-time home buyers that will really help you with down payment assistance. If you have issues needing repairs to your home, this is where those waiting lists that Brooke was talking about can be really long for Section 8. They do have emergency housing. If it's an emergency situation, they should be able to get that. But lots of grants, lots of programs for housing. Now for services for children with mental health issues, there's lots of resources here through the Department of Mental Health and Substance Abuse. Tons of resources here, just tons. And they have it divided by age group, which I think is very helpful. Very nice, good resource. And I really like the way that this webpage is set up. It's easy to use, easy to find information. So definitely take some time and explore that. So I mentioned Chant earlier on the Family Health and Wellness page, but this is just its individual page that definitely gives you more resources. If you click on resources, there's tons of more resources. So you can't say you didn't know because I'm showing it to you. But, it's just taking the time to really go through and seeing what services are available. Tennessee Voices, they're another good resource for mental health, for parenting, great opportunities there. And then this has got to be my favorite, y'all. This can help you with everything. This has helped me in my school because I'm still in school. I'm a nerd. This has helped in program planning. This has helped in grant writing. This has helped with just so many things. So there's, 3 different areas here. If you want to learn a new skill, get help taking action and contribute. So if you go under help taking action and go under databases of best practices, you've got so many resources here on building communities, community problem solving, community-based prevention, database of intervention. There are just so many resources here. They have toolkits. I mean, this is the best site ever, I have to say. So if you really need help, definitely check that out. So I went through all that very fast because I wanted to save time for questions and then also for some agencies to share about anything that has worked well for them. So let me get back to the presentation. And I've got some questions that we can really look at when we're thinking about how what we need to celebrate our successes because you all work hard and you need to be able to share your wisdom and success with those that you have worked with. So I want to allow you the opportunity to do that. Oh, Not that one, though. Okay. For some reason, it's still trying to give me my main slide, but I will scroll through it. Just scroll through it real fast because I didn't want to just jump to this slide for some reason. All right. So do we have anybody that we would want to share about what positive outcomes that you wanted to achieve, or how did you gain and sustain any partnerships in your programs? And how did you plan for the future by developing long-term goals and outcomes? So any of those questions, if you have anything that you would like to share about what you've done, I'd love to hear from you.
Well, I'll start. My name is, can everyone hear me? Sorry.
Yes.
Yes. My name is Aisha Goodman. I am in Memphis, with Le Bonheur, Strong Family Housing Initiative. And one of the things that we were able to uh, build a partnership with for all things was car repair. The
Okay.
transportation system in Memphis is going through some changes, whether it's growing pains or shrinking pains, whichever way. And transportation is a huge piece. Without transportation, you can't get to your work, you can't get to here, you can't da 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 da. It's a domino effect. And even with providing our families with rideshare, that was becoming, that can become expensive. So for families who had cars, but their car was not working, we were able to find um, a a repair shop that offers towing and car repair, and they were willing to do a partnership with us. So we was able to they'll do the quote, they'll send us the paperwork, and they was willing to accept payment through our system. So I think that was the biggest thing, because to work within the system of Le Bonheur.
Right. Yeah, that can
That's
be a
one.
barrier sometimes when you have like, how can I pay you, and make it work with the grant, and making sure that you're within those regulations for how you spend the money. But that's great. That's awesome. Thank you for sharing, Asia.
Welcome.
Anybody else want to share any successes?
Hi, I'm Faith from Portico. I'll share one real quick.
Okay.
We are building a partnership with a fellow agency in our area called Stepping Stones. And with cost problems and just the struggles that go along with pregnancy, just the different costs that arise and the struggle to work consistently. They are kind of partnering with us with just supporting the housing situation for our clients. And so that's a huge help, because that ends up being a barrier and an issue as we go forward with supporting our clients.
Mm-hmm. Definitely. That's great.
This is Sarah with Hannah's Hope. We have developed a relationship with Birthright here in Memphis, which is also a small nonprofit. They take women through 8-week parenting classes during their pregnancy, and those classes end not long before the babies are due. And so the staff at Birthright and the volunteers there help assess needs of those women as far as supplies goes, safe sleep kits, feeding kits, car seats, that kind of thing. So we come in at the very end of those classes when they're having kind of their graduation celebration and do a baby shower and provide them with those necessary items. And then our social worker and executive director start working with them if their needs continue, and can do home visits and things like that after delivery. So that we've done 2 of those now, and that's kind of like a bi-monthly thing that we're going to start doing. And so far that has been probably, I would say, our biggest achievement thus far with the Strong Families work.
Yes, and I bet your families are so appreciative of that. That's a great opportunity for them to get a lot of resources at one time.
Yes, they are. They are. We load them down. But just the relief on their faces when they're given things that they have to bring their babies home from the hospital is
Yes, yes. Taking a lot of stress off their plate. That's good.
Anyone experienced any specific struggles working with another partner? You don't have to tell us who it is, but maybe just had a hard time finding a specific kind of partner.
Sometimes the response time, after you have referred a client to that agency, the response time of for the response to your client can sometimes be slow to none. That's, so now you might be looking for another agency.
Right. That would be one you just want to make a little side note. Little side note on, or see if there's somebody else in the agency that is better at communicating. A lot of times it's those admins. I tell you what, admins know everything that's going on. So if that agency has a administrative secretary, administrative assistant that you can contact, sometimes that's better than just going directly to that provider, case manager, or whatever. So, yeah. If we don't have any more agencies, we have a couple of minutes left for questions or reflections. So in the beginning, I did ask you to kind of have some ideas in mind of what agencies you might want to create some partnerships. So does anybody have anything that's come to mind that they want to explore, or any agencies or resources that I might have put up on the screen that you might want to follow up with? Was any of that new information for you?
I think the American Job Center. I know I have been sending clients there, but that is
Okay.
one agency I would like to meet with, because when you are working with clients who may be a single parent and they may be that sole breadwinner. I have had many of them to voice working from home because they want, doing recuperating and things of that nature. So just putting them in touch with agencies that can work with them even after they may no longer be working with me. So, contacted them to those agencies that may be a longer term
Right,
and a consistent, resource for them. So
right.
if you know of the person in Memphis, feel free
I'll
to put
tell
the
you
name in
what,
the chat.
we have a consultant in Memphis. If you go to our SWARP's website, under regional consultants, we have 12 regional consultants across the state. So Stephanie Ellis is who's in Memphis, and you all can partner together. You all can partner with any of your consultants in your area to learn about resources. So of course we're working specifically with DCS, but we have access to lots of resources. So it is very important to have an actual contact person So you're not just saying, oh, here's the job center number or website, but like really refer them to an actual person. Just like you want to have a person that you can follow up with. Well, they want that too. So that's why those relationships are so key. And then even though in our field there's a lot of turnover, if you have that relationship, more than likely they're going to be able to say, hey, my last day is in 2 weeks, but I just wanted to let you know. And then maybe you can follow up before they leave and see if they've hired a replacement so that you can keep that continuity and that relationship that you've had maybe with the new person. So, but yeah, it is a struggle with turnover issues. I know that's something that we face at DCS, but all right, well, I think we're kind of close to time, so I'll let Brooke wrap us up.
Awesome. Well, thank you so much, Kristina, for presenting this really important topic and for giving us a lot of ideas, not just for our project directors who may be out in the community having these meetings, but also for, case managers or people that are working directly with our families and clients just on how to, network ourselves and network with other case managers. I think you gave us a lot to think about and a lot of great resources. So we really appreciate your time today. And of course, we appreciate everybody else's time for being here as well. Like I said, I will send out all of those resources on a nice Canva document this afternoon. And then of course our survey and all of the CEU information for y'all that need it. Please hang on the line if you need to ask me any questions about the CEU process or any other questions that you may need to chat with me about. But aside from that, oh yeah, and there's our QR code if you want to go ahead and knock that evaluation out for us this afternoon. But aside from that, we really appreciate everybody being here. I will get this recording up on our website probably tomorrow, but definitely by the end of the week. And we'd love to hear from you if there's something that comes up. We hope everyone has a wonderful afternoon.